Do you really know who is treating you in Canada? Behind closed doors, doctors who have been suspended or revoked in other countries are entering Canada without proper background checks. If you skip this, you could be putting your family's safety, your care, and your future at risk. This isn't just a small issue. It could impact the very trust you place in your healthcare. You won't want to miss what comes next. Imagine if some of the doctors treating you were never fully vetted. What if a loophole in the system allows unsafe professionals to slip through? In the next few minutes, I'll show you the shocking truth, how this could affect your health, your taxes, and your jobs. Stay tuned because what you see next might change everything you believed about Canada's healthcare system.
Refugees come, we do criminal record checks, but when we are recruiting medical professionals, we just leave it up to the provinces, and that's probably why we have 80,000 medical professionals that are not currently employed.
Here is what you're going to hear next. I need you to sit with the weight of this truth. A recent investigation, as Burton Bailey highlighted, uncovered that doctors in Canada have been allowed to practice despite being suspended, reprimanded, or even completely stripped of their licenses in other countries. Lena Metledji-Diab acknowledged that licensing bodies handle suspensions, but that is where the darkness lurks. How many have slipped through? How many doctors whose past is hidden are now treating you, your family, without you ever knowing? Let me reveal some crucial insights. There is no centralized verification system. Each province is left to guard its own door, meaning red flags are lost in the chaos. Immigration records are lagging, the files we rely on sometimes, miss crucial disciplinary updates, leaving us blind to danger. Local licensing bodies are overwhelmed, struggle to keep up, and in that void, patients are unknowingly exposed. Taxpayers may be left bearing the cost. If these errors go unchecked, we could pay a price far beyond what we imagine.
A recent news article pointed to an investigation that uncovered doctors in Canada were practicing with reprimands, suspensions, or outright revocations of their licenses in other countries. In the past 10 years, how many people have been admitted into Canada by the Federal Immigration Department with suspensions or revoked medical licenses in other countries?
Suspensions, revocations of medical, all of that is handled by licensing bodies and health.
Don't know. It's okay. You don't know.
What if the system that promises to protect us is actually keeping us in the dark about who we welcome into our country? What if we're trusting a system that is falling apart before our eyes and we don't even know it? What you are going to see will be really shocking, and let me explain what this means. Burton Bailey asked a vital question to Immigration Minister. If we don't even know the number of doctors whose backgrounds are in question, why are we allowing a system to continue that we already suspect is fraudulent? Lena Metledji-Diab said she didn't know which people he meant, but that ignorance is what we can't afford. This isn't just a debate, it's a warning about how little we know about who is entering our healthcare system and who is being allowed to stay. Let me share some crucial revelations. There is a dangerous lack of transparency. Immigration is operating without a full picture, so we never truly know who is entering. Decisions are made with gaps. Immigration officials rely on incomplete records, leaving them blind to past problems. International checks are missing. There is no standardized process to verify global disciplinary actions.
If you don't know the number, why would you authorize the continuation of a system that you admit is kind of fraudulent when these people are entering in our country and not being truthful?
And I don't know what people you're talking about or what specific people you're talking about.
Okay,
We're here to talk about our immigration system, but also our...
What if the decisions being made today are setting us up for a tragedy tomorrow? What if a simple check could have saved lives but was never required? Next, you will hear, and let me show you how deep this problem runs. Burton Bailey asked a straightforward but terrifying question. Does the Immigration Department require a basic search of the U.S. National Practitioner Databank or the UK GMC sanctions list before approving permanent residency? If they don't, he asked, how is that not deliberate negligence? And that question hung in the air because the answer wasn't just a yes or no, it was a revelation of a system that could be failing us at the most critical level. Let me share some crucial revelations. We have no standardized global verification. There is no mandatory cross-border search, meaning red flags could be missed. Immigration officials rely on incomplete tools. Without these basic searches, they are making life-altering decisions in the dark. The system is vulnerable to exploitation. If bad actors know this loophole, they can slip through and exploit our good faith. The risks are far-reaching. It doesn't just affect one person. It affects whole communities when trust in the system is broken.
Minister, yes or no, does the Immigration Department currently require a simple basic search of the U.S. National Practitioner Databank or the UK GMC sanctions list, for example, before granting entry or permanent residency to an individual with reprimands or license suspensions? If the answer is no, how is that not deliberate negligence?
What if the very institutions that we trust to protect us are actually turning a blind eye? What if, instead of safeguarding our health, they're passing the buck, leaving us vulnerable to danger? Before the next thing play, I want you to sit with the reality. Lena Metledge-Diab shifted responsibility, saying that licensing bodies, hospitals, and institutions should verify before a doctor practices. But Burton Bailey exposed a deeper failure. Immigration Refugees and Citizenship Canada isn't double-checking. This means that doctors who evaded bans abroad could be exploiting Canada's skilled worker stream, and we are left in the dark. Let me share some crucial revelations. There is a reliance on institutions alone. Immigration is handing off responsibility to hospitals, but without a second check, they miss crucial flags. There is a dangerous gap in the express entry system. Without independent verification, we have a system that allows evasion to go unchecked. Trust in our immigration system is being eroded. When people realize there is no double check, they stop trusting the whole process. The human cost is irreplaceable. When errors happen, it's not just a policy failure, it's a failure of care, and that cost is paid in lives.
If you're asking if a person that's coming to practice medicine, that's what the licensing bodies and the employers who are the hospitals or the institutions, that is their role in terms of verifying all of these before the individual is able to practice in Canada.
So we don't double check. So Immigration, Refugees, and Citizenship Canada justifies failing to mandate independent verification in express entry for medical professionals, effectively allowing those evading bans abroad to exploit Canada's skilled worker stream.
What if the people who are supposed to be checking these doctors are too far removed from the truth? What if the recruitment trips, the facilitation, and the handoff between immigration and hospitals are a veil that hides weakness in the system? Before you will see what will happen next, I need you to really grasp how this process works. Lena Metledge-Diab said that when she was in Ireland and the UK, she recruited doctors with the College of Physicians and hospital leaders. She called it facilitation, but that work, the critical verification, was handed off to the licensing bodies and the employers. This is where the system breaks down, because that handoff, that reliance on others to verify, is often where the truth gets lost. Let me share some crucial revelations. The recruitment process is disconnected. It relies heavily on local bodies, but they may not be equipped to spot past issues. Immigration acts as a facilitator, but not a guardian. They are not mandating independent checks, so the risk slips through. The hospitals and employers act as filters, but they might lack the capacity or the time to do a deep dive. The human cost is cumulative. Each missing verification leaves a gap that could cost someone their safety or trust in our system.
I was in Ireland and UK, and at the time I was recruiting doctors, and I took with me the College of Physicians. I took with me the hospital director from the hospital who was the employer, and and that's what their job were. That's what we were there as facilitators from the immigration department. But all of that work gets done by the licensing licensing bodies, by the employers or the hospitals.
What if the very safeguards we think protect us are actually just a patchwork of inconsistencies? What if we are being sold a lie that everyone is being checked, when in reality they are slipping through the gaps? Next, you will hear shocking truth, and I need you to feel the disillusionment here. Burton Bailey called out a critical hypocrisy. We do criminal record checks for refugees, but when it comes to doctors, we just hand it off to the provinces. That inconsistency, that laziness, is why we have 80,000 medical professionals who are unemployed, because we never double-checked. Lena Metleg, Diab said that no one coming to Canada would be allowed in without a criminality check, but we're seeing that it doesn't actually work that way. Let me share some crucial revelations. There is a critical gap in oversight. Criminality checks for refugees are strict, but for skilled workers, they are fragmented. Immigration relies on a patchwork. Provinces take control, and we have no central guardian. This is a breeding ground for exploitation without a strong unified check. Bad actors slip into the system. It's a catastrophic waste of talent. 80,000 doctors struggling, unable to serve, because we failed to verify.
Refugees come, we do criminal record checks, but when we are recruiting medical professionals, we just leave it up to the provinces. And that's probably why we have 80,000 medical professionals that are not currently employed.
Anyone coming to Canada would not be admissible unless they pass the criminality check.
Thank you.
Before we close, let's bring everything together. From the very beginning, Burton Bailey raised a serious concern. How many medical professionals with past reprimands or suspensions may have entered Canada without full transparency? That number was never clearly confirmed. Lena Metleg Diab explained that immigration facilitates entry, while licensing bodies and hospitals are responsible for verifying credentials before someone practices. But through this exchange, we learned something deeper. We learned that criminal background checks are not the same as professional disciplinary checks. We learned that verification responsibilities are divided between federal immigration and provincial regulators. And we learned that there is no clearly mandated centralized international database search built directly into the immigration approval stage. Most Canadians never get access to this level of detail. They hear about immigration targets and healthcare shortages, but they don't see how these systems connect, where gaps may exist, and who is accountable at each step. If you want more deep breakdowns like this, immigration news, Canada Current Affairs, House of Commons analysis, and upcoming national projects, make sure you subscribe to Canada Insight Network. Stay informed, stay aware.